Hello and welcome to the Healthcare Leadership in Action podcast from the Faculty of Medical Leadership and Management. My name is Judy McKimm. I'm Pro-Dean and Professor of Medical Education at Chester Medical School, Professor Emeritus of Medical Education at Swansea University Medical School and Associate at FMLM. This second series is focused on postgraduate leadership development and assessment. It is sponsored by the Dinwoodie Charitable Company as part of a project to improve leadership development and assessment for doctors in training. Hello, everybody. Welcome to the FMLM Podcast. This is part of a short series sponsored by the Dinwoodie Charitable Foundation, and we've worked in partnership with the foundation on a project which has culminated in these podcasts. I'm joined today by some good friends and colleagues of mine. First, Dr. Joe Lipton, who's consultant anaesthetist at Guy's and St Thomas's Hospital in London. He's also the lead for assessment at the Anaesthetic Curriculum Development and Assurance Group. We also have Dr. Chris James, who's an Anaesthetics Registrar in South East London, and he was also in the 2019 to 20 cohort of the FMLM Fellows. And finally, but not least, we have Professor Sue Carr, who is Deputy Medical Director at GMC, and she's also a consultant renal physician. So thank you, everybody, for joining me today. And we've got a series of questions, which I will pose to you, and then we'll make it into a conversation as best we can. So, Joe, I'd like to start with you first. This is all about leadership development, this podcast, and I'd like to ask you, as a trainer and a relatively new consultant, why is leadership development important to you and your trainees?
Thanks, Judy, and thanks for inviting me on to the show. I think that my reflections on the importance of leadership development is best contextualized around my own experience. I got involved in the design of the 2021 anaesthesia curriculum while I was still in training myself, and took on an increasingly large role in devising the assessment strategy, particularly for some of the earlier milestones in the programme. And that was a really formative experience for me because I was suddenly found myself in a leadership role with quite high stakes and interacting with people a lot more senior in that process than I felt. And it was very eye-opening to me that I was given the freedom to operate in that setting when previously I hadn't been. And I was almost waiting as I went through that journey to be given some kind of explicit license to lead. And it wasn't until I perhaps reflected on it retrospectively that I realized that nobody was ever going to give me that pass. And it was down to me to acknowledge to myself that I was able to lead something, that nobody was going to rubber stamp my ability, and that I was going to have to prove myself in that role if I wanted to be listened to and heard and to achieve something. And I carried that lesson into my early consultant career. I've only been a consultant for coming up 3 years. And what I could see around me was a lot of trainees that were having a similar type of experience where they wanted to make an impact. They wanted to change their environment and improve the service that they were delivering, but they never felt like they were necessarily empowered to do so. And they were perhaps waiting on some level to be given a license to do that. And I think I realized that that was something where I could make a difference. If I could put in place some kind of system, some kind of support to empower trainees to use their knowledge and skills to make an impact in their workplaces and to do something that would drive them in that direction. So I think that's kind of where I'm at now.
Thanks. We'll come back to the work you've been doing around the hub, because I think that's really interesting, and it leads with the General Medical Council's work as well. But just for now, Chris, as a trainee who's been a fellow of FMLM as well and worked with Joe, what does leadership development mean to you, and how have you been supported to develop your leadership?
So I think it's great leading on from what Joe's just described, because I think it definitely resonates with me as a trainee looking for those opportunities as well. And I think, I was fortunate enough to be in the 2019-20 cohort with FMLM, which, if anyone is considering it, I can't recommend highly enough as kind of a way to get into it. And I think it's a massive topic when you get into it. You come across lots of theories, books, and you get promised these sort of golden ideas of how you should go about stuff. But For me as a trainee, I think, as Joe said, it's about understanding and gaining the insight that it is a journey, that you have to go on, that it's a learned skill. And I think as trainees, we understand that in the clinical realms, but we don't necessarily appreciate that fully in the non-clinical. I think as a trainee, we're kind of in that middle management piece. So it's about learning to be useful, about how you develop those opportunities. It's about being curious. And I think as a senior person says to me, it is about being kind as well, and learning how to kind of appreciate that, you know, everyone's trying to do the right things. And I think the final bit to what Joe has said about how do you get into those places yourself and into those opportunities. It's about developing the confidence to start making proposals and start being in and around problems in the NHS, in training, or in and around other problems, and having the confidence to put forward a proposal, and then developing the skills to actually be able to land those things and enact kind of that change. We're very used to it in a clinical setting, but I think for this, it's more about your personal development and about understanding that it is a personal journey. And it's also about the organizational development as well, and trying to understand a bit about the world around you. You know, myself and Joe spent a long time talking about trying to get trainees into spots where they're understanding the financial aspect, the managerial aspect, the clinical aspect, and bringing it all together. And that's, you know, not easy at all. And then I think the final bit that we often hear in training, which has been a real journey for me, is this idea of resilience. I think it's become a bit of a dirty word. I think often it's thrown out as for a means of coping. And I think for me, it's about how do you actually get trainees to start excelling in these difficult environments rather than just coping. And I think once you get that insight that it's a journey and it's a learned skill, then you start to see the world a bit differently.
Oh, that's really helpful, actually. Yes, personal development journey. The concept of that kindness and compassionate leadership is really important, isn't it? And actually taking some responsibility, I think, for yourself in your own development, as well as having people to support you and guide you and signpost you into different directions. So, Sue, I'd like to ask you now. So, from the General Medical Council's perspective, obviously you have done a lot of work. You and the council have both done a lot of work in the leadership development space. So do you want to just tell us a little bit about that? And then also perhaps how that leadership development, reflecting what Chris and Joe have said, how that links into some of the guidance that you have produced and are currently producing. Thanks.
Yes, thanks, Julie. So from the GMC perspective, I think as we've heard from Joe and Chris, we're all agreed that clinical leadership and clinical leadership development is really important for our doctors and doctors in training. And we've seen from various articles recently that we know that where clinical leadership is strong, that organisational performance is strong, quality of care and patient safety is improved, and that good leadership is associated with less burnout and higher satisfaction in doctors. And we've seen, unfortunately, the reports, back to mid-staffs and more recently some of the maternity reviews when the clinical leadership hasn't gone particularly well. Thinking about the GMC data as well, the background for this, that we know at the moment our doctors, there's more burnout in doctors, reduced satisfaction, and we've seen sort of very worrying information about levels of bullying and sexual harassment. So I think in terms of developing doctors' clinical leadership skills, it's just really important that that all doctors develop clinical leadership skills so that we can have more compassionate, inclusive workplaces where we have a really positive culture and we can address some of those challenges that are going on. So probably, I'm not sure, I know you're very familiar with, Julie, the Michael West report that highlights this as well, and just really outlining that where we have good leadership and positive cultures arising from that improves workforce morale, motivation, well-being, etc. as well, and most crucially, patient safety. So this is kind of the background to the GMC's guidance, which has changed recently. So as you know, the GMC produces standards and guidance for doctors. And one piece of guidance which has come out recently and comes into effect in January next year is the Good Medical Practice Guidance 2024. And there's some key changes in this guidance that relate to clinical leadership, around the fact that all doctors, we all have a duty to develop fair, inclusive and compassionate workplaces. And if you look at the new version of this guidance, you'll see that championing fair and inclusive leadership really does have sort of centre stage. So that's one context that the GMC is inputting in terms of standards and guidance. The other area where we have standards is in education. So for undergraduate and postgraduate education, the GMC has standards, outcomes for graduates, for undergraduate medical students, which sort of have a whole section about leadership. And in the generic professional capabilities, which links so well to what Joe was talking about the hub, there's a section in the generic professional capabilities which outline those softer skills in medicine that are integrated into all curricula, and that articulates what doctors should learn in their training about clinical leadership. So just coming on to just say one other thing about that. We've heard from Chris and Joe about doctors' leadership development, and we looked at some interesting data in the GMC National Training Survey, looked at doctors' experience of leadership training. And it did show that, often doctors' expectation of leadership training wasn't really met in the workplace, suggesting that we do need more opportunities for experiential workplace learning, and that some doctors, more than others, were more or less likely to get access to those opportunities. So I think, in addition to, we know there's a lot of really good formal leadership training opportunities, and I think Chris referred to that there's some great courses and things. But I think what we really need to be focusing on is that experience that doctors in training get in the workplace, and the opportunities they get for shadowing, role modelling, projects, mentorship, etc., are all so important to developing those really key skills as clinical leaders. So I hope we're going to talk a little bit more about the GPC hub that Joe talked about as well.
We are in one moment. Definitely watch this space. So that's really interesting, isn't it? We can see how certainly the FMLM standards and guidance, the good medical practice, the new version, the generic professional capabilities, and certainly the work that we did on the Dinwoodie project, which was the early work we did last year. We did a big survey as well, and absolutely what you say about leadership development, the formal side is really good, but actually that day-to-day workplace role modelling, and sometimes it's just not signposted as leadership, and people are still expecting the big L leadership, leading a department or an organisation is leadership, but those day-to-day little tasks that are managerial, like rota, designing the rota, leading a ward round, all those things are leadership. And working with people is often involves leadership as well. So it's maybe that just foregrounding it. And I call it using the L word, not love, but leadership. But we'll have love as well. So off the love and back to your work, Joe. I think this is a really good piece of work. And this is how we met, isn't it? Talking about the hub. You've set up this hub as a focus for your trainees to engage in leadership development activities. And it's mapped onto the generic professional capabilities as well, isn't it? And it supports the department and it engages consultants and trainees together. Can you just tell us a little bit about the purpose of the hub and the key activities that are available both to your trainers and to the doctors in training that are working with you?
Yes, definitely. So, I mean, so much of what both Chris and Sue have brought up were feeding into the impetus, if you like, for creating something like the GPC Hub. What came together for me was that we had this great opportunity presented by the curriculum change and the incorporation of generic professional capabilities into the 2021 anaesthesia curriculum. And what it did was to foreground something that had previously resided in the back pages of people's CVs, really, which were those projects and other opportunities in research, quality improvement, medical education, etc., that people understood to be important, but which served a particular function, usually around recruitment and kind of acquisition of prestige, rather than around personal and professional development or enacting change in workplaces. So we had this change in curriculum, and at the same time, I was just assimilating myself into a massive department of anaesthesia in a massive teaching hospital, wherein we suffered with a lot of common, I suspect, problems around trainee anonymity, around lack of agency that trainees experience when working in big and complex workplaces. And I could see that there were these two things that could be brought together, wherein we had a curriculum that was emphasizing the importance of developing generic professional capabilities. We had a department, an institution that would benefit from incorporating trainees more effectively into their strategic objectives. And then Chris came along, and Chris was just fresh out of having had his experience at NHS England. And we had some really stimulating early conversations about, like, what could we practically do to put all these things together and give trainees more meaningful opportunities in our organization. And so what we tried to do was to look at our department's governance structure, look at the areas of activity where there was loads of stuff going on that trainees could meaningfully contribute to and benefit from. And that was in education, in research, in sustainability, in quality improvement, and in digital transformation in particular. And we then tried to construct an educational framework around those things whereby trainees' involvement wouldn't be so opportunistic. It wouldn't be based on who you happen to be on a list with that week, but it would be a little bit more transparent as to what were the opportunities that were on offer. And what we came up with was what we called the GPC Hub. What's taken shape over the last 18 months is that trainees in our department, and now increasingly in our region, can participate in the GPC Hub on one of three levels. So for everybody, irrespective of their other commitments, we run a monthly GPC Hub symposium program, and it's rotated around each of our core work streams. We deliver content and have showcase project opportunities. We build it into our departmental teaching program. And that enables people to see what's going on and to listen to interesting talks. What we then do is we have a system for showcasing project opportunities. So that's the kind of next level up in the hierarchy. If you have the capacity, then you can take on a project, and not just a project that has a limited scope that seems like a quick win, but something that's aligned to the departments and increasingly the system's strategic objectives. And these might be things that have a bit more of a long timeline, where you mightn't be able to necessarily complete a project, but where you can contribute to a meaningful part of it. And that brings us on to a real mindset shift that we're trying to encourage with the Hub, which is we don't expect you to take on tiny little projects with a limited focus that you can complete and tick off a box on your end of year ARCP, but instead we want you to develop by taking part in something meaningful, and we want to facilitate that. And I think the biggest thing, which is at the top of our pyramid of our educational framework, is that we created new roles for trainees. And what these are is trainee lead roles that are deputizing roles alongside the consultant leads for each of our work streams. And those trainees take on a special significance in our department because they share oversight of what's going on within the department. They act as intermediaries between our big consultant cohort and our big trainee cohort, and they facilitate the engagement of their colleagues. And not only do they then bring other people into project work, but they also find themselves put in spaces that they're not used to being in. So they go and represent the directorate at departmental level meetings or trust level meetings. They're expected to and encouraged to speak up in those fora. And what we find is that trainees are empowered by doing that. And they then begin to develop a skill set that they didn't realize was already nascent actually within them. So what has started off as just a trust level project has become something that I've been building out in the rest of our School of Anaesthesia. And the really key alliance that we've built is with the newly formed South East London Anaesthesia Network, which is convened within the Acute Provider Collaborative. And this is a new space that trainees really haven't had much experience participating in. And as of this month, actually, we've just convened the first network board meeting. We've got trainee rep roles in that network. And through that, I hope we're going to be able to open up even more opportunities to take part in projects that will be new to trainees, that will also showcase to senior leaders, actually, that trainees are people that can contribute meaningfully in this space and who really should be being prepared for the responsibilities that they will take on in their consultant life in the not so distant future.
Great, thanks. And I think, we've seen this work, haven't we, develop from, as you say, the embryo of the idea to now it's actually being replicated. And it is a model, I think, that can be replicated in all specialties in various contexts, because it's sort of the concept, isn't it, and the principles that underpin it, rather than actually it being in anaesthetics or wherever. And so, Chris, you've been travelling along the journey from in different ways. And just reflecting back on your training so far, what would you say have been some of the key moments and opportunities that have given you a bit of an aha moment or a bit of a boost? If we think about the positive aspects first, and then perhaps you'd go on and say just some of the challenges that you've encountered, that would be really helpful, and how you've overcome them. Thank you.
So yeah, I think for me, being a trainee, I did get very frustrated. I definitely got burned out, and I think, I've recently been having a look at the GMC survey around trying to understand what it shows, and kind of hopefully speak to trainees down the line about a bit more in depth their views in these non-clinical domains. I was definitely in that spot. So I took some time out, and I ended up doing, I worked on cruise ships for a year, which is a different thing. I'm not sure there's a huge amount of leadership development in some ways. There is certainly in other ways, working in remote environments and things. But when I came back, I think it was almost for me a bit of a permission to go looking for different things, really. So the FMLM fellowship popped up as something that one of my friends had done and sort of recommended it highly. So I went in 2019-20 into that fellowship, and I was lucky in some ways. So that was the end of 2019. So when I turned up at NHS England, we were looking at the tail end of Brexit planning. We then got very quickly into pandemic planning. And then obviously everything that happened since then from COVID. So I was in the emergency planning room from day one, really, with that. So I think that was definitely a big opportunity and a big kind of shift in my understanding of the world and kind of myself and the NHS as well. And I think one of the things that I realized during that time was that seniority, people don't necessarily know what they're doing. And I don't mean that in a, I'm not criticizing. I think it just became more apparent during COVID because it was seen as unprecedented and kind of uncharted territory. But actually going back to kind of now, how I view the world in terms of trying to be useful, trying to be curious about things and working in a kind manner. I spent my first days in amongst that with the emergency planners, just doing things like getting teas and coffees, getting food, supporting the team, taking notes, organizing meetings, all the rest of it. But actually, I spent a lot of time on the side really understanding the subject. So I read everything that came out of Italy at the start, read everything that came out, the guidance, etc., and quickly became a bit of a clinical support for the team. And you soon start to realize that because you were in and around something and you were being useful, that people started to come to you with other opportunities. So you start to, get asked to write up a proposal or, lead a meeting or whatever it may be. And one of the things I certainly learned during COVID was that it wasn't unprecedented and it wasn't uncharted. You just had to go back a little bit further in history. You go back to the 1800s and the cholera epidemics and things like that. And I was fortunate enough to start reaching out to, we had social scientists, we had philosophers, we had, obviously all the infectious disease experts. But for me, it was about that, almost again, a permission to be curious about stuff. So I'm going to start reaching out and start asking, and I'm start trying to bring it all together. And that's something that's really, really stayed with me through that journey, that you will start to get those opportunities. And you start to go back to the experiential learning point that we've talked about. It's a different world when you're not sat in a meeting as a rep or as something like that, but you're sat in a meeting with a problem to solve. So I was no longer sat in half an hour meetings. I was, getting in the habit of setting up meetings that might only be 5, 10, 15 minutes long because I had a particular thing I needed to get done and I needed to make it fit into the boss's kind of strategic vision of what he needed done, all under time constraints, et cetera. And you start to really develop that, that way of working that kind of puts you under the spotlight and under pressure to do that. And it has to be something meaningful. I think going back to what we tried to do at Tommy's, if it's not something meaningful, then you don't really get traction. You don't feel the pressure. You don't feel the sort of the interest. So I was fortunate with that. And then I think that the biggest thing that happened to me during that year as well is I worked with so many different people. So we were fortunate enough during that time, the military came in. I worked with the Logistics Corps. We worked with military intelligence. We worked with consultancies. I worked with Palantir Technologies, who then actually hired me alongside training afterwards because we put together some projects with that. And again, you learn that you're switching between some of the fun and exciting stuff back to I'm getting the team biscuits, and that's fine because it's whatever's needed in that moment to really bring something forward. So that was certainly the positives is learning that you're allowed to be curious, you're allowed to ask questions, but you can also come up with a proposal, table it, and get given the opportunities if you show you can do it, and you're really looking to put that theory into practice. And FMLM is a fantastic organization. It really has. With our work, it was one of the first organizations we came to around the Tommy's work and the regional work, because you start to discuss problems and you get feedback in a way that you've not really thought of it. And you get, I've had some gentle feedback that's difficult to hear, but you need to hear it. Otherwise you're not going to develop. And I think the ability to coach and mentor is something that's not widespread out there because it's a very, very difficult skill. So I think that's certainly brought with it the positives. Yeah. So that year changed my view of the world. And I think, unfortunately, at the moment as it stands, you don't get that level of experience and opportunity within clinical training, possibly because we're still focused on exams and clinical stuff. But also I think there is a mindset. For me, it's every interaction. It's the behaviors. It's you have to get into that mindset of every little thing I do is something interesting. It doesn't have to be big and exciting, and the be-in thing, it can be as small as somebody's struggling with something and you have a quick chat with them, or you liaise with somebody well, or you make something happen in quite a small way. So it's been interesting for years, but I think FMLM definitely set me off on that journey, so I'm very grateful for that.
Oh, that's good. And the fellowships are fantastic, and of course there are lots of different fellowships. But as Sue said earlier, these are almost for the few, not the many, to coin a phrase. But what I think comes through from what you say is something about that having some time, or the mindset. So it's sort of plugging in, isn't it? These sort of quick moments, almost to reflect on something or to engage your curiosity. And I think we do drum curiosity out of training, out of people in training and education, unfortunately, which is exactly the opposite of what education should be. So that's really, I think that's really interesting. And also that multidisciplinary aspect. Medicine can be very singular and one track, can't it? Whereas, if you're thinking much more widely and engaging with different people, you get that wider perspective on life. And also being kind to yourself. I think I heard that from what you said as well. That's really important. So, Sue, in terms of, not just the GMC's work, but your own experience, you've been in many leadership roles, but how could trainees use the generic professional capabilities or the new, the new guidance that's coming out? How could they use that to help guide their leadership development? And I'm going to ask you to conclude with a top tip about leadership development from your own experience. So that's, I know.
So I would say I tend to think about this in sort of three different ways, Judy, really, which we've touched upon in both Joe's and Chris's comments. So first of all, on a sort of day-to-day level, in everybody's everyday role, all doctors are leaders in their own domain. So whether you're a sort of fairly early career doctor doing your rota or organising a teaching session, it's sort of recognising what within your own day-to-day role is a leadership activity, and then sort of thinking about that, making sure you've got some evidence and sort of documenting that in your portfolio, maybe asking somebody to do an assessment for you or write a reflection, so that then that's visible in your training. And remembering that leadership comes in many different forms, doesn't it? So there's day-to-day clinical work. You might be involved in a research project, recruiting patients, or you might do something in education, which is a leadership activity. So it's kind of being conscious that all these things are leadership. And if people are struggling with that, have a chat with their educational supervisor or a sort of trusted colleague to sort of say, well, how do I identify my role? What's leadership? I think the second sort of area is around projects, and I think Jo talked about this. So certainly as a trainer, I think a lot of trainers lack some confidence in their own ability to teach leadership, and I know that's something that I've sort of experienced over the years until it finally dawned on me that I was in a clinical leadership position. So I think for trainers, having some ideas about projects. So one, just an example from, I used to be a director of education in a large trust, and we used to look after the trainees on the, it was then called the Academic Foundation Programme, and you and I did that together, Judy, didn't we, in many ways? So I would have a sort of 2 or 3 projects that each year, because they're only with us for 4 months, and nobody can start and finish too much useful in that time, as a standalone project. So we would ask subsequent foundation doctors to contribute to a project. So one that we did was called the Gripes Project, which is about junior doctors speaking up about concerns. And over a couple of years, those contributions to that project turned it into a really valuable tool, which became part of the trust's business as usual, and has sustained for years since I moved on from that role. So I think Jo said, recognizing that your contribution quite often in junior and senior leadership roles is, often we contribute our parts to something. We don't do the beginning, the middle, and the end. And I think that's important as leaders, that we're often a brick in the wall to building something better. So seeing those opportunities, and then finally those bigger opportunities we've been talking about, getting some shadowing, asking people you're working with if you can follow them to an important meeting, and the shadow boards that Jo was talking about. I think these are all brilliant opportunities. And again, in my previous role, we set up a Doctors in Training shadow board sort of committee, and the members of that committee got great opportunities to go and be a representative at other forums where they wouldn't have previously really known that they existed or had access to. And then finally, there's the fellowship type opportunities for people who want to take some time out to study leadership in more detail. But I think the real key thing, I guess my top tip in a way, is I think just remembering that, all as a doctor, everybody's a leader, and a lot of the things you do in your working week are leadership activities, and sort of recognizing that you have a lot of power in that role. So, I think we all have a duty to sort of to contribute to our workplace cultures. If we want compassionate, inclusive workplaces where people don't get burnt out, there isn't bullying and harassment, then we all have a role in that. And keeping that curiosity that I think you said, Judy, we need to be interested in individuals and their views about things. So if somebody says something and you don't agree, think, can you just tell me more about that, please? So I think these are leadership responsibilities as well, aren't they? Helping to build our teams, speaking up and demonstrating those compassionate, inclusive behaviours right from early in your career, and building on that with the formal training and the everyday training that we've been talking about, and then reflecting it in your training or appraisal documentation as a consultant.
Thank you. I think that was quite a few top tips, which is a bonus for us, isn't it? I think that's great. Yeah, bricks in the wall is a really good metaphor, isn't it? And just that little bit of a part. And that's a bit like the servant leadership, isn't it? Where you leave a legacy, you're contributing something bigger than you. And of course, the inclusive and person-centered leadership. And I still like curiosity. I think Chris was the curiosity to start with. I'm very curious about everything. It's my nature. So,
can I ask, as obviously the three of you being in more senior positions than I am, I think one of the things that my FMLM year taught me, and subsequently, is that as a trainee or someone more junior, if I were to reach out and contact somebody more senior for a coffee, for a quick chat, or to join a meeting or whatever it may be, my experience is that it's pretty much universally. I mean, now and then you get a no, but pretty much universally, people think it's great. They think that you're interested, you're engaged, and I think for a long time I was worried about doing that, and I just wonder whether you guys, I know all of you have been very gracious with your time, and people in your positions as well, but I mean, again, as a permission from someone more junior, presumably you guys would be very positive response to that sort of thing.
Yeah, but I'll definitely say yes. And I think sometimes if we're really busy, I know everybody's busy, but sometimes we're sort of like super busy. And if people reach out to me and I'm just a bit like, I'll get back to you, it's not because I'm not interested at all. It's just a prioritizing thing. But we want people, we want to leave that legacy behind us, especially Sue and I, because we're moving on in our careers. And so we want to leave a legacy, and people who are coming up behind us, not in a bad way, are actually the next generation of people who will take things forward. So I love it when people reach out, and I'm a teacher anyway, so I would, but yeah. And Sue, what about you?
Yeah, no, I would completely agree. I mean, I think I would personally, if somebody contacts me in that way, I would never say no, and I don't think any of my consultant colleagues would, because we're curious to know what that person wants to talk about as well. So there is that to get. And I would say some of the best projects I've done have been where a trainee or an international medical graduate doctor or someone has reached out to me and sort of said, "Can I come and talk to you about this?" And you think, "Oh, yes," and then sort of hearing their different perspective has often triggered some really good ideas and work streams. I think the other thing about that is, as a consultant and someone in a clinical leadership position, you've always got a list of things you need to do. And of course, if somebody comes enthusiastic and interested, it's quite good to be able to give them a job to do as well and get them involved. So it's often a two-way project. And I guess, the final thing is, I know our fellows, so I look after the FMLM fellows in the GMC. And I often say to them, when you go back to your organisation, make sure you contact everybody and tell them what you've learned and, how can I get involved? And people are often anxious to do that. Or I say, don't just make that contact, because people want to know what you've learned. They are curious, and they'll either find you a job to do or you'll stimulate some sort of idea for, a work stream that will be valuable, in some direction or other. So definitely, have the confidence to do that. It will be welcomed.
Yeah, exactly.
If I could add to that.
Go on, Joe. Yes, sorry. We'll edit ourselves. You add to it.
Yeah, my kind of piece on that is everything that every opportunity that has been valuable to me has probably come from a speculative email that I've fired off to somebody. And it comes back to a bit what I said at the very beginning about waiting for permission. You'll wait forever to be given permission to do something or to grapple with a problem that you think might be out of your reach to even consider. And actually sending that email and taking that small risk of rebuttal, which is very, really very small, opens so many doors. And the more it becomes a positively reinforcing behavior for you when you start to have those tentative interactions with people that you perceive to be so very different from you, so very much more senior experienced. I think Chris alluded to it in his experience in COVID emergency planning. We're all human beings, not so very different from one another. And you can easily buy into the notion that you are, in some way inferior, far less experienced, far less grown up. And I'm putting that in air quotes. Actually, we're all rather closer together than we might believe in that respect.
That's really good. Chris, is that your top tip then? don't hesitate to reach out, or have you got another secret tip?
I mean, I'm not sure secret tips. I think it certainly is. I think it's definitely helped me massively along the way. And every now and then you obviously get either ignored or gently pushed aside, and that's absolutely fine as well, given that everyone's very busy. But I think the other couple of things that I would say from my time has been I was introduced to action logics by FMLM, which I think are excellent. And whether you use that or something else, it's having a framework of understanding where you are and where you're trying to get to. I think that for me was very, very important. And I think the final thing really, on top of once you get into those positions and you're trying to be useful, you're getting that curiosity going, and you're sort of developing that ability to also be kind to people around you, I think is having that ability to put proposals together. And I know that I bore Joe to tears sometimes with some of the proposals that I come to him with, but I think it's a realization that it's not the done and dusted project. Your ideas won't survive contact with anyone else, but it's having the confidence to say, oh, look, I understand this problem. I've been in and around it. And actually, if someone's seen it, I would like to give this a go, but this is just the first draft, and we're going to build, I want to evolve, and I want to use it as a means to developing certain skills. So I think for me, the final bit is having that confidence to come forward with a well thought out, considered proposal, in the knowledge that it's never going to happen in that way, but in the knowledge that it might put you off on that step towards, an interesting experience in that journey. So for me, I think it's all of the tips kind of build up to that idea of actually don't be worried to get, go to somebody with a proposal of what you think might help, and it can be big or small, but it will teach you so much, I think. I'm not claiming to be good at any of this stuff, but I'm interested in it, and you certainly learn a lot. And I think that's the other thing. Don't be kind to yourself, in the sense that the key point is not about the success, it's about the development. And as long as you're learning something, then it's worth it, I think. I was about 8 top tips. I apologise.
8 top tips. This is such a bonus episode. What a podcast this is.
It's interesting stuff. It gets me going. But so I think that's the proposal thing. I definitely think it opens doors. It starts conversations. I think that's what I'm trying to get.
I agree. Yeah. So it's about ideas, isn't it? It's back to that, having ideas, seeing a problem, thinking what might be done about it, and then talking to people. And you're absolutely right. Leadership is so much about connectivity. And often if people contact me, I'll say, I'm not the right person, but I do know the person who is. And I'll pass them on in a good way, and actually say, I think you two need to have a conversation. And I do that at work all the time, connect people up. I don't try and do everything myself at all, because I can't. I'm not capable. So I'm going to end with you, Joe. You're going to have the final word. What would your top tip be to trainers now? So we've heard quite a lot from a sort of different perspectives here. But what about some practical tips for trainers or supervisors who actually want to support this leadership development and help give people the opportunities that yourself and Chris have highlighted have been so valuable?
Yeah, I think that my take on this is that what I've certainly tried to do, and what I would encourage others to do, is to look at your workplace, your organization, and ask yourself, what can I change? What can I put in place to open up new opportunities for trainees to have experiential learning opportunities in these kinds of spaces? And some of the words that we've referenced during this conversation have been culture, have been inclusivity. And I think those two things really resonate with me on this, because at present we have a culture in our workplaces where trainees don't really expect to be consulted or included in a lot of the operational delivery of care. They expect to operate fairly separately and in parallel, pursuing their own learning needs, developing as clinicians, participating in on-call rotas, but not always with a real stake in the bigger picture of what their organization or their healthcare system is doing. And I think that's a huge culture shift that we're trying to push back on. So the practical way in which I'm trying to do that is to create new opportunities, create new roles, create new spaces where trainees feel welcomed and empowered to go. And then the next thing that I do alongside that is, what can I do as an individual, or what can I create in my department to ensure that trainees are supported when we give them those opportunities, that they go into those places and have experiences that are not always necessarily easy, that might be really challenging, that might make them wonder whether there's any point actually. What I want to do alongside creating the opportunities is providing the support That might be through individual mentoring conversations, through guided reflection, through other systems that I put in place to make sure that they are having their voices heard. But those are the two things: create opportunities and support people while they have them. Those are my tips.
No, that's really important, isn't it? And, I think I once invented a model of the 7 C's of clinical leadership or something, but certainly some of the C's in there are compassion, caring, culture, conflict, being able to mediate that. And I think that supportive cultural aspect. Now, culture takes a long time to change. And so back to the bricks in the wall, you might just put some of these steps in place as a leader or as somebody, particularly if you're traveling through in your training journey, but actually that contribution will help shift the culture and develop this mindset of curiosity. So I think that's been I think it's been a really interesting conversation. I hope people who will listen to it have got this far and got to the end for all the tips. I would just like to say thank you very much to all of you for giving up your time. I know you're all busy. So thank you so much to Joe and Sue and Chris. And on behalf of FMLM and the Dinwoodie Charitable Foundation, thanks ever so much for participating in this podcast. Thank you for listening to the Healthcare Leadership in Action podcast. If you want to learn more about what we do at the Faculty of Medical Leadership and Management, check out our website, www.fmlm.ac.uk, or follow us on social media, X at FMLM_UK, or you can find us on Facebook and LinkedIn. Thank you to the Dinwoodie Charitable Company for sponsoring this project, and to our producer, Dr. Sharia Khan, and advisor, Dr. Ray Carlson. We'll see you on the next episode.